This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Cuflift Advanced Cough Formula Syrup is an effective remedy for productive coughs. It helps clear mucus and eases breathing, making it ideal for respiratory issues. Indications and uses. This syrup is indicated for managing productive cough associated with several respiratory conditions, including bronchial asthma, chronic obstructive pulmonary disease, COPD, chest congestion, bronchiectasis, and emphysema. It effectively thins and expels mucus from the respiratory tract, providing relief from chest congestion and facilitating easier breathing. How it works. The combination of Ambroxol, guaiphenesin, and Terbutaline works synergistically to relieve respiratory symptoms by loosening thick mucus, increasing its volume, and relaxing airway muscles. Directions for use. To use this syrup, shake the bottle well before each dose. Measure the required amount using the provided measuring cup and consume it immediately. It is recommended to take this syrup twice daily, ideally in the morning and at bedtime after meals. Always follow your healthcare provider's instructions regarding dosage and duration of use. Possible side effects. Common side effects may include dizziness, drowsiness, stomach upset, and headache. Although usually mild, it's advisable to consult a healthcare professional if these effects persist or become bothersome. Precautions and warnings. Before taking this syrup, it is crucial to inform your doctor if you have any liver, kidney, or heart issues, diabetes, or a history of seizures. Pregnant or breastfeeding women should consult their healthcare provider before use, as the safety of this medication in these populations has not been established. FAQs. 1. What is this syrup used for? It is used for relieving productive cough associated with respiratory conditions. 2. Is it safe to use? Yes, when taken as prescribed, it is considered safe. 3. How does it work? It thins mucus and relaxes airway muscles to promote easier breathing. 4. How should it be taken? Shake well, measure the dose, and take it after meals twice daily. 5. Are there any side effects? Possible side effects include drowsiness and stomach upset. Thank you for watching. If you have any questions or suggestions, please feel free to leave a comment below. Your feedback is appreciated.